Hello everyone, this is Audrey and welcome to my channel. Last time I spoke and shared with you the port procedure that I had a port inserted because of the chemo. They couldn't find my veins and it was very painful, and I just wanted to I don't think I've ever showed you what it looks like. And so it's like a little bumpy thingy inside. It's like a round tube, I think. I didn't speak too much about the experience. It wasn't a wonderful experience for me. It wasn't painful. I developed a fever and a cough. I went to the emergency room and they did some blood work and an x-ray, chest x-ray, and I was told that I have pneumonia on my right side of my lungs, and I was sent home to take antibiotics for a week. I started taking the antibiotics and I felt like nothing is improving. I still have the fever. I feel even worse than before, and so I went back to the onco daycare, which is like an emergency room for cancer patients, and there I was told that I should be hospitalized because my situation did say it's because of the chemotherapy that actually damaged my lungs to a point, and then I got the pneumonia. So actually what happened was the antibiotics worked, the fever went down, I didn't have to have the lung biopsy. I was very much afraid of that, and I was released from hospital 2 days later. So during that time I had lung infection. I couldn't start my Taxol chemo. After AC you have Taxol. You start Taxol. I was supposed to have 12 therapies of Taxol. I didn't get that. It was stopped, obviously, because of the pneumonia. And then something happened. When I was in hospital, I actually started feeling some pain in my right breast. And I touched that area and I felt a huge lump, a big lump, a very painful lump. And I knew right there and then that that it didn't feel good. And so once I was released from the hospital, I contacted my oncology nurse, and she immediately scheduled me an appointment with my surgeon. I went and I had the ultrasound. The doctor that did me the ultrasound, she immediately, I saw her eyes going very big. And she said, listen, you have to have a biopsy right now. The biopsy, it was very, very painful this time, actually, because the lump was painful. The first biopsy I actually had several biopsies before this one. I also had an MRI biopsy, and it wasn't painful at all. Didn't feel anything. But this biopsy, and they explained it to me, is because the tumor, the lump is painful. So I anxiously waited for the biopsy results. I obviously knew that it's a tumor. So there you go. I waited 2 weeks for the biopsy. I received the results this week on Tuesday. Monday, I received the results, and my surgeon literally was in shock. She couldn't understand why the tumor, which was obviously positive cancer, was a different type of cancer that was in my previous tumor, and I looked at the results she gave me, and I saw that it was metaplastic carcinoma, squamous cells, something like that, squamous cells, which is the type of metaplastic cancer, because you have different types. You have the spindle cell and you have the squamous cell. And I think the squamous cells are like, you can actually literally have pieces of skin in the tumor, and the spindle cell type is you can actually have cartilage or bone pieces in the tumor. Now this tumor is growing at a rate that it's literally shocking. I mean, it's literally popping out of my breast, and it's filling my whole breast, and it's very, very, very painful, very tender and very painful, so much so that I cannot even sleep at night. And later that day, a couple of hours later that day, I received a phone call from her, and she said, I spoke to your oncologist and we've come up with a decision what to do with you. You need to go immediately for a PET-CT scan to see that the cancer has not metastasized. Because if it has metastasized, we cannot give you a mastectomy. Because the cancer is already metastasized. So on Tuesday I will have a PET-CT scan, and I hope and pray that the cancer is still local, and that I will have the mastectomy and then continue with some kind of a chemotherapy, most probably. So metaplastic cancer is a very, very rare cancer. It's an aggressive form of cancer. This tumor is growing very, very fast. It's unstoppable. It's chemo resistant. They still do chemo because there are a percentage of people that actually does benefit from chemotherapy even though they have metaplastic cancer. Like less than 1% or 1% of people around the globe has this type of cancer. Very, very rare and strange form of cancer. So there you go. This is the update. Obviously it's scary. It's very scary. I still am very positive. Life goes on. I'm hoping for the best, hope and pray for the best, that there's no cancer that has metastasized, and that I will get the treatment, the right treatment this time for my cancer. So it's a beautiful day, it's summer, it's hot. I found this lovely spot not far away from my apartment. Lots of trees. I will keep you posted, inform you of any news, and we'll take it from there. I wish you a wonderful day. Thank you for watching, and please subscribe.